video on. We don't have audio. I think we now have audio. Welcome.
Hi, how are you?
Wonderful. So we've
I
got.
apologize. I signed in the way all the participants signed in.
No worries.
My
no
email
worries.
now.
I got it. These new and emerging technologies are a little rough on the first go, but I think that we've got you in now. We're really excited and really grateful that you're able to be with us. I did a couple of sort of housekeeping at the beginning and did some introductions in terms of getting us started, but really wanted to just immediately turn to you. Number one, let's hear how you're doing. And also, we'd love to hear just a 30,000-foot level introduction into the CARES Act so that members of the public can be introduced to it, learn some details about its implementation, and then we can look to see what we have in the road ahead of us.
Yeah. Congressman, you're on. You can go ahead.
Okay, hi everyone. I'm delighted to talk to you. I'm of course at home with my own little studio that I set up in my extra bedroom, but it gives me an opportunity to tell you where I think we are. In Florida, we haven't not yet hit the peak of this terrible virus, and staying at home is part of the strategy. Basically, we want to try to starve the virus. So at the federal level, we've been able to do 3 different bills, and I want to talk about the latest because it's the one that affects you and all of our families in South Florida, and my district in particular. I'm happy to answer questions on anything, but let me start by telling you what the federal response and assistance is going to be. And are we going to flip these screens? Yes. 80% of us, not me, because I'm excluded, 80% of everyone in our district will get a direct payment, probably a little higher than 80%, given the range of incomes that we have. If you're a single parent who makes $109,000, you'll get nothing. But if you make under $100,000, married parents will receive 0. But let me go down, keep going on this stimulus checks. This gives you a sense, if you're under $75,000, that's the most important thing. This is gross income adjusted. Now, how's the government going to do that? They're going to either use your 2019 tax return, or if you're like me and haven't gotten that done yet, they're going to use your 2018 tax return. And without a child, you're going to get $1,200, and with a child, you're going to get $1,700. Now, let me talk a little about gay parents in particular. If you file together, if you're married, you certainly will be treated that, and you're treated that way by the IRS. You will get the income that's indicated here. And this means that you're going to get a cash bonus. Essentially, you're going to get some of your taxes back, or some of the taxes of your friends and families back. And this idea was to put cash in your pockets. Republicans weren't as enthusiastic about this as we were, because we really wanted to get cash into people's pockets so they could pay their, begin to pay their rent, and, but more importantly, pay for food for their families, since you're stuck at home for the most part. Let's keep going. The small business stuff is really important because it's very creative. It used to be that you could go borrow money from the Small Business Administration at relatively low interest loans, and you would pay it off for a period of time. What we're trying to do with small businesses, by the way, this is businesses who have under 500 employees, with the exception of the hotels. We made an exception for the hospitality industry, and Florida Congress people did that because of the impact on South Florida in particular. If you're in a nonprofit, For example, if Save has a real challenge keeping their employees, they could go and get a small business loan, and it's intended for immediate payroll relief so that you don't do mass layoffs. And the government will forgive up to 100% of the loan if you retain the same number of employees as when you receive the loan. That means we're essentially taking these loans and converting them into grants. And I think that's really important for our not-for-profits. There are a lot of not-for-profits in the LGBTQ community that may have trouble keeping their employees. Now, if we can go to the next slide. If they have trouble keeping their employees, they really can't go get small business loans for a wide variety of reasons. Then unemployment insurance is going to be available. The first program, the SBA program, is going to be administered by the federal government. That is, SBA is part of the federal government. And they're just starting to gear up and figure out how they can get these SBA loans out in our community. They may use the banks to get them out. Down on Miami Beach, they're talking about using the convention center with proper separation of people to try to give people advice on how to use the SBA. But if you're not eligible, if you've been laid off or even furloughed, you can now apply for unemployment insurance. Well, you can't do it right now because, tell you the truth, the IE system is not up and running. And these are what our projections are in terms of people that are going to be laid off in South Florida. But let's go back to the other screen, because this is really important, because we've done something really cool. Because we live in Florida, the average weekly amount that you would get if you normally apply for unemployment insurance is about $275 a week. What we did, what the Democrats did, is talk the Republicans who have never liked the UI system. And as you know, in Florida, they've been cutting back on the number of weeks for a long period of time. We're going to add $600 a week on top of the weekly maximum for 4 months. In other words, we're going to try to help you to recoup your salary. Now, this is if you're laid off, if you're furloughed, even furloughed, where your employer is willing to pay your health care, but not willing to pay your salary, or they can't pay your employee. Now, we've expanded this to self-employed people, for people that are in the gig economy, for independent contractors, and for people that are unable to start a new job or a contract due to the pandemic. So we've covered a much larger group of people on unemployment insurance. Now, I'm warning you, don't try to call the unemployment number, because they're just starting to get organized. They're hiring more than 100 people. I've been talking to our state legislators, particularly to JJR and to Nick Duran, about specifically how the state is getting organized. The state has never done this number of people, so it's going to take them a little while, but they're trying to gear up so that they can get these benefits out. But the money is there. We've also given the state money to gear up. So we didn't simply say, well, you got to do it with your present people. We put a lot of money in for them to gear up. But this is really important for you, for your friends and family that are out of work, because we tried to cover every group we could think of in unemployment insurance. And then on the small business loans, we've converted them to grants. What we're trying to do here is pretty straightforward. We're trying to cover as much of your pay as we possibly can, including giving you cash up front, so you can start to pay your bills. And in addition to this, as you well know, some of the people that own buildings are willing to talk to their renters about putting some things off. Let's see the next slide. This is the number of people who have applied so far. It's really hard to apply. You have to wait for hours on that phone number, but it'll get easier as we go along. And so there are a lot of people in Florida that are going to be applying for these benefits. But we've put plenty of money into the system. And for the Florida part, the state part, they've got reserves, about $6 million in reserves, or $6 billion in reserves to cover it. But we've put plenty of money into the system. So you will, in what I think is a relatively short period of time, be able to get some checks. Keep going. We also want to make sure, obviously, that people are able to register to vote, and we're going to push vote by mail. Both parties, I'm sure, are going to, and early voting and online registration. It's time now for everybody to really register online, because we all may be voting by mail. But we wanted to put a lot more money than this in, and we're going to try in the next bill we do to put a lot more money in, because we think vote by mail is the way to go for the future. Next slide. There are a lot of healthcare benefits. For the first time, we're actually putting in some money for telehealth. In terms of out-of-pocket costs for COVID-19, the vaccination, if it comes online, we're expecting it not for a couple of years, but the testing now is totally covered. What we have not completely covered is additional assistance for people that don't have coverage. A lot of people are going to have to register for Medicaid if they have no coverage, or for the Affordable Care Act if they can afford to pay for the Affordable Care Act. But if you have private insurance, if you have government insurance, if you have Medicare or Medicaid, or you're on the Affordable Care Act, or you've got veterans benefits, or you get your medical through TRICARE or the Indian Health Service, you'll be covered for your costs of treatment. In addition to that, we want to make sure that nursing homes are safer, and have put some money in to increase their infection control. And we've put a lot of money, $1.3 billion, into community health centers. Those are important in our community because there are 21 of them. They're able to do testing, and they're going to be able to help people along with their treatment. Now, there's no treatment as of now. And a lot of people are just going to be tested, and because they're younger and they're healthy, they're going to be sent home. Others are going to end up in the hospitals here in town. Let's keep going, because I want to make sure I get to. There are a lot of emergency funds that are available, and we're obviously investing in making sure that the PPA purchase is going on. We've got to support our healthcare organizations here in town, and we put about $100 billion into that, and another $100 billion for health entities to apply for reimbursement. We're going to have to put a lot more money into the healthcare system. Every hospital in our district is losing money because people either aren't going to the hospital for their routine kinds of operations, or they're afraid to go because the hospitals are dealing with COVID-19. Let's keep going. I haven't talked at all in this, we don't have on here what we're doing for seniors. Anyone over 65 that needs home delivery of food, of meals, can get it by simply dialing 113. That's the number that Miami-Dade uses for senior services. And we have provided enough money to Meals on Wheels and to other senior programs in this bill that we've just passed to cover anyone over 65. And frankly, if you're 63, they'll probably deliver the meals. We want to make sure that all of our seniors have enough to eat, and there are going to be no questions asked. We're just going to deliver food. And of course, the school system already funded to deliver food to kids, and they're picking that up at designated schools, and that was done in an earlier bill. So,
Congresswoman,
And
One
also
correction.
funded
Congresswoman, if I can jump in, it's 311.
311. Sorry about that. Not 113. 311 is the number for seniors, but we've also funded food banks as well. So both Meals on Wheels and food banks are funded through our most recent bills. So let me stop there. I know I've run through it very fast without a lot of philosophy here, but the point is that we delivered large billions of dollars to help workers, to help seniors, to help kids. That's what we focused on. That's what I've focused on. And the Republicans are obviously, and I'm supportive of bailing out some places that will keep their employees on their payroll, like American Airlines, for example, and other corporations in our community. But we want to make sure that our restaurants come back into business, that our hotels come back into business, and that our industries come back into business. And that's what this is all about. But what it's really about is saving lives. We want to save lives first, and then we can talk about the economy. Let me end there, and let's take questions.
Absolutely great. Thumbs up. Can you hear me, Representative?
Pardon?
Can you hear me?
Yes, I can.
Okay, good, good. Just wanting to make sure that I came through. So when I go through the questions, I could sort of bundle a couple of them together. And a lot of the questions that are being asked are about additional legislation that will expand on the first round of legislation that has come through. In particular, one of the questions is citing, looking at this $1,200 payment. Is there any possibility that that could be expanded, given really how much it's being criticized in comparison to countries like Canada and Denmark? Also, organizations like chambers of commerce that are 501c6s, can the bill be expanded to include those types of organizations as well? So I'll just punt over to you to talk about additional legislation or expansion.
Well, first of all, anyone that's a not-for-profit business can apply for small business loans. So that ought to cover small chambers of commerce, for example, because that's a not-for-profit. In terms of more cash payments, I think that's likely, but to tell you the truth, we'd like to get people on unemployment insurance right away because we put a lot of money into it, and we'd like to help small businesses to keep their employees on their payroll as much as we can, because that's the best way to keep people linked to the economy. There are two big gaps from my point of view. Number one, for people that don't have health insurance, we need to find a way in the next bill to put that in. Everybody's got to be covered for their treatment for coronavirus. There ought to be no question about that. Right now, if you're in one of those gaps, your treatment is not covered. You will get it because the hospitals, if you're really sick, are not going to turn you away. But we really need to make sure that people are fully covered and we fill in the gaps there. And the other one is we've left out the post office department. The post office as part of our effort to retain large businesses. And as you know, it's kind of a semi-private organization now. There are a lot of employees in the post office, particularly minority employees in Miami. I'm worried the post office is going to go belly up. That's a disaster, by the way, for our election, let alone a disaster for the individuals that work there. And I'm going to fight for the post office department. But first, I'm going to fight for an expansion of healthcare for those that don't have healthcare. And Florida is a particular disaster because we haven't extended Medicaid. Okay.
Thank you. Thank you for that. I was actually at the post office early this morning, and they came to mind in terms of how they're able to keep going with the work that they're doing to get our mail system moving, especially if we're going to be dependent on that for our election cycle. So I'm going to take another small bundle of questions that we have. These are mostly related to the president's comment relating to the distribution of personal protective equipment out into the health community, out into our healthcare systems. A particular concern that one of our persons asked was regarding how are we making sure that the federally qualified health centers are getting the kind of equipment they need if they are the front line for the most vulnerable communities that are out there. And so there's a huge emphasis on how are we overseeing that trickle down of PPE equipment, protective gear.
At the moment, it's highly fragmented. The federal government is doing it at a certain level, and then the state government is getting an allocation from the feds, and it's up to them on how they're distributing the PPE equipment. Here's the way most of the hospitals are getting it. They're applying through the emergency management people in our county, and they're sending the request up to Tallahassee, and Tallahassee is processing the requests and trying to fulfill all of the requests that are being done. Let me check about the federally qualified health centers. Raul Martinez, my district director, is on. We've got a long list of them. And Raul, if you'll check back with them and seeing if they're getting it directly or whether they have to apply the way Jackson and UMH and Mount Sinai and all the other hospitals in our district or the Baptist system has to apply, but we'll check on that. And you're absolutely right. We've got to make sure that they're covered as well. I did a round of phone calls, but I'm happy to check back. Thanks for the question.
Absolutely, thank you. And I know that one of the comments you made earlier is that this is still a developing response, and in a call that was held previously, Representative Javi Fernandez did share that the website for businesses, which is one of the questions that's come through, is that where should businesses go to look for information? And that's floridadisaster.biz, and so .biz. Wanted to make sure to be able to share that with you. A question that has come through is related to your role previously as having been the Secretary of Health and Human Services. The question here are the measures that are not being taken at the federal or state level, or what should we really be advocating for, and sort of tapping into that prior experience that you had in that leadership and how you see this.
Well, you know, it's hard to go backwards because we're trying to go forward, but let me say that for years, including particularly in this administration, we've been cutting the public health infrastructure. What do I mean by that? I mean the community, the state health department and its units, the Miami-Dade Health Department, they've been underfunded. In addition to that, for management and financial reasons, we don't have the number of hospital beds per person that other countries do, because we've moved to what we perceived as a more efficient system, an outpatient system as opposed to an inpatient system, because science has moved in that direction, not anticipating that we needed surge capacity. Now, in Miami-Dade, our hospitals actually have surge capacity and plans for that because of hurricanes. So in some ways, we're a little better organized, though for testing large numbers of people, we're not well organized because we don't routinely deal, the viruses we deal with are flu, for example. So we don't routinely have to deal with thousands of people that we're testing for a virus, because that's handled in doctor's offices or in hospitals, and in some cases in emergency rooms at our community health centers. We do have plans for surge capacity, but it's only related to hurricanes as opposed to something like this. We have thought this through over the years, but never properly funded it. And so we've started in every administration to do this right. But I'll tell you the truth. I testified for years before Congress, 8 years. Every year I talked to them about the possibility of an outbreak and our inability to properly fund state and local health departments, laboratories, building surge capacity. Everyone in public health knew that a virus was going to come along, which was going to sweep the world, and that we weren't well prepared for it. The slowness of this administration to get off the ground has caused an even larger problem. So in the future, I believe we're going to think this through. We're going to have better stockpiles. We've always had stockpiles, but not nearly at the level we needed to do, and how you renew them is a big challenge. So there are a lot of elements here that all of us in health policy have thought about, never bringing it all together and getting the proper funding. I believe in the future we will, but meanwhile we have to stay at home, wash our hands, practice social distancing, and starve this virus.
Great, thank you for those reminders. I think that they're helpful to keep top of mind. One of the questions that comes through is a person who's in a situation in which their income in the prior year was much higher, and therefore they would have qualified for a smaller amount of check in the distribution based on the chart that was shown earlier on the income requirements and the benefits that are available. Her statement is that in 2020, in this year, she's actually due to be earning significantly much less, and therefore would love to be able to have access to a greater benefit. And I don't know if you know if there's any kind of mitigation that can be done to be able to sort of work around the prior return that was done in 2018 or 2019.
Not for the cash payment, but certainly she would be eligible for unemployment insurance, and she ought to apply because that $600 on top of whatever she's eligible for by the state is just there. We did it as a block so that it didn't vary by income. It just had to do with whether your income disappeared. For most people, it's disappeared. And whether you've had a dramatic change in income. So I want to be really accurate here. Most of this stuff is sort of locked in. And they really are going to, if you filed your 2019, they're going to look at that because the IRS wants to get these checks out. If you haven't filed your 2019, then they'll take the 2018 tax report, and it's adjusted gross income. Sorry about that. I really know what the problem is because people's income varies. But if she basically lost her job, she certainly can apply for unemployment compensation.
Yeah, and I think this is a scenario not of a lost job, but just of varying income. That's very helpful. Thank you. The next question that came through piggybacks on one of the statements that you made earlier regarding American Airlines. That is a company that has a lot of touches a lot of people here in our community, given that this is one of the hubs of that airline. But one of the questions that's come through is regarding the cruise ship industry. Again, there's a lot of people in this community that are impacted by it. However, there's a lot of awareness that these cruise ship companies are not American-based companies. And so there's a sort of a tension there in terms of benefits that can be provided and support that could be provided. Talk a little bit about that industry. We're also impacted by the tourism industry. So our hotels our hotel workers are also suffering, and those particularly boutique companies that are here.
Yeah, first of all, the hotel workers are covered. And the hotels can go in and get small business loans, the boutique hotels, if they need that. But if they need to keep their people employed, they can go to the Small Business Administration, no matter what their size is. We made an exemption for them. And they can apply for initially a loan, but it converts into a grant when they keep their employees on their payroll. So that group's taken care of. Let me say first about American Airlines. I care a lot about that company because they've got a lot of employees, but I'm concerned about their subcontractors, the people that don't make a lot of money. And part of the deal with American Airlines is that they've got to keep their people employed. And if one of those subcontractors lets people go, they will be eligible and they'll get their full pay through the unemployment, through unemployment compensation. But what we really want is for American Airlines, which is going to get a lot of money, to keep their subcontractors working as well, because we'd rather have the money that we allocated for the big corporations basically be focused on their employees. And there's language in the bill for that. As for the cruise lines, here's the challenge. They don't fly under American flags, so they don't pay American taxes. That's the problem. But their employees are eligible for unemployment compensation and for the checks. So in some ways, we've taken care of their employees. The question is, will they need an infusion of cash just to survive? But in terms of their payroll and their employees will be eligible for unemployment compensation as well as for the cash that we're going to put out based on their income the year before. So we've tried to take care of the employees in Miami-Dade. Here's the challenge, though, from my point of view and what I feel badly about. So many of their employees are not citizens of the United States, and therefore don't file U.S. taxes. If they don't file U.S. taxes, they're not going to be eligible because they work for essentially a foreign country. But for Americans, they will be eligible. So we, again, as Democrats, we focused on workers. We want these companies to survive because we obviously are committed to these large corporations that employ millions of people. But more importantly, if you look at what the industry does, the cruise industry, we got a lot of people that work for the port. And a lot of their income depends on the cruise industry. So we'll be looking at that in the future. But meanwhile, we focused on workers and on their workers that live in Miami-Dade in particular. So that's the best answer I think I can give you.
Thank you.
You can
Thanks for
see
that.
where our hearts are.
That's right.
It's first workers and then the companies.
Absolutely. So there are a couple of questions here about what's happening next. What are the priorities that are starting to surface? You know, this is an enormous bill that was passed, right? It's the largest that's ever been passed by Congress. But there's a sense that there's more needed. And so the questions here are about what is going to trigger Congress to take its next action? What are the priorities that are starting to come to surface for you, for the party, and for the House? What are you hearing and what's coming up there?
I don't know what that is. I have no idea what that is.
Let's see.
That's someone trying to call you on Skype.
Let's let it go to voicemail real quick.
I'll let it go to voicemail. I can answer that question. First of all, yes, I think there'll be a fourth bill. There's no question that there'll be a fourth bill.
Okay.
First, we'll make some technical corrections on this bill. When you do a bill as quickly as we just did, and it's drafted and negotiated, you make mistakes. So first, we'll do a technical correction. That will probably be done by voice vote. And then we'll do a fourth bill. Here's what I think our priorities are that we know of today. We've got to get people who don't have health insurance coverage if they get sick from the coronavirus. We've just got to, the costs look like they're almost $100,000 per patient when they end up in the hospital. It's not the people that have mild cases that can stay at home. It's people that end up in the hospital. The hospitals are already bleeding money. So the question is, do we give more money to the hospitals per patient, or do we start giving people insurance so that they're covered no matter where they end up in our healthcare system? My preference is to give them insurance, that covers COVID-19 at the minimum. I'd love to give everybody insurance, but that would be the minimum. That's number one. And number two, for me, probably is whatever investment we have to make in the supply chain to make sure that PPE and the ventilators and all those things get out. And of course, I've already mentioned that I really think that we've got to go back to the post office and get rid of some of their liabilities to make them viable for the future. We need the post office. Apparently, the President of the United States doesn't like the post office. I love the post office, as does everyone I know in Miami-Dade County. So I'm going to go fight for the post office as well.
Excellent. I'm just going through a couple of questions. So there's a couple of ones that have come up here regarding I think, unintended consequences of what happened when you shelter in place. So there's a concern for people who are sheltering in place, who are victims of domestic violence, or children who are victims of violence, and they're now having to spend much more time at home. And is there any thinking or any part of the safety net that we want to highlight at this time to be able to talk to people about what's available for these individuals who are trying their best to shelter in place, but they might need a place where they can find a safe and secure place to be?
Yes, our safety net for those that are abused, whether it's children or whether it's a domestic partner, is still in place. So those telephone numbers, which we could also put on our website, are still important to people in our community. And I am very concerned about that. I'm also concerned about just mental health in general. Look, it's not easy to stay at home. Most of us have never stayed at home for this long since we were little kids and got sick, and a parent kept us at home for a week. But we're going to have to figure out creative ways to keep in touch. But we need that safety net, and we need to make sure that those numbers are available, that people can get to safe places. And there are a number of key places here in town for domestic abuse victims, for their children, and the safety net of children's services will continue, so that people that know about a case ought to be able to continue to call those numbers, because there will be follow-up.
Wonderful. So I feel like I have exhausted the number of questions that have come through. They've all been sort of a variety of ones that I've clustered together. I wanted to give you this opportunity to sort of leave us with some final comments about things that we should be looking at for, ways that we can not only take care of ourselves, but take care of our community. And then we can sign off for the rest of the day. And I got a couple of comments to make at the end when you're done, but I wanted to just sort of punt to you for some final comments.
You know, the LGBTQ community has always been great about supporting each other. And now we have to do, we have to ask you to do it in imaginative ways. And that is, you've got to keep in touch. We've got lots of ways to keep in touch now, because we have a different media platform in which we can keep in touch. And I think to the extent that people can use Zoom and Skype and do more than just make a telephone call to friends, that's important. But reminding everybody that social distance is important. I went on a walk the other day, and everybody was keeping more than 12 feet away from each other just to get some exercise. But for most of us, we're going to spend all of our time inside, and washing our hands, taking seriously that we have to keep a safe distance away, and literally taking care of ourselves is really going to be important, because what we're trying to do is we're trying to I'm not sure we can kill the virus completely, but we certainly can squeeze it as tight as we possibly can. The balance between getting back to work and and the healthcare. We've got to listen to our healthcare people, listen to the very good scientists, physicians that are giving us advice now. Let me also say this virus is not a Republican or a Democrat or an independent. It's not gay, it's not straight, it affects everyone and it doesn't discriminate. And so we're all in this together and all of us have to work together no matter what our political leaders have said. And, you know, at the moment I'm pissed off with the governor because he thinks South Florida, building a wall around South Florida is the way to manage this virus. And it's got to be a whole state strategy, but it's really got to be a national strategy. We know what we need to do, and we just have to literally, visually put our arms around everybody, link arms, and do what we've always done, and that is work together to starve this virus. And we'll live to fight another day, but more importantly, we're a proud community, and we need to demonstrate how extraordinary this community is when it has a challenge in front of us. And I'm there. And I'm there fighting for you every day. And if I have to fly to Washington like I did a couple of days ago, which was frankly ridiculous because some idiot decided he wanted to make a quorum call. And by the way, the Republicans were as mad at him as the Democrats were. You should have read my email from Mario Diaz-Balart because he laid into Mr. Messing from Kentucky because he forced more than 200 of us to go back to Washington to literally voice vote and to demonstrate that there was a quorum. But I'll take whatever risk it will I have to take to do everything I can to support this community. And we just imagine a community like ours, which is so diverse, but knows that if we pull together, we'll get through this together. Thanks very much. Thanks.
Yeah, thank you. Absolutely. And thank you for showing up on Friday for that voice vote. That was a pretty egregious demand, but all of our congresswomen from this area, we saw them on social media making their way out there. So we were really proud of the efforts that you were doing. We want to thank you and the staff. We also want to thank you, of course, not just for voting on Friday, but also for being the sponsor of the Equality Act in May of 2019. That bill, if it's fully passed in both houses of Congress, would amend the Civil Rights Act to include sexual orientation and gender identity. You were a champion there, you were a sponsor, and we know that we're waiting for the Senate to make a move on many things, including that. So thank you to our audience members. We're going to send an email to all participants with a list of all the resources that were discussed today. Please stay tuned for our speaker series. On April 6th, we will have Vice Mayor of the City of Miami Beach, David Richardson, with us. I hope that everybody remains safe